Gay men, being first aware of HIV-AIDS in the 80s, became very alarmed and scared. At that time, there was still very little or virtually no governmental response. Society, including the government, was not taking this illness, this epidemic, seriously.
The most dominant sense of what we were up against was just the uncertainty and the fear. You know, in those early days and in the mid-'80s, death and loss was so pervasive.
It took a lot of courage, I think, for those leaders in the face of large scale of denial among many members of our communities to say we have to respond, and even when no one else is responding, we've got to take care of ourselves.
This was the first time in the history of the species, really, where people what they shared was a disease, where they organized and got together with each other and asserted their right to have their voice heard at the decision-making at all levels that impacted their lives.
This is not an American disease. This is a worldwide pandemic. As bad as it continues to be in the United States, it is in many ways, many times over, worse around the world.
I'm a gay man. I'm supposed to have been the first gay man to have come out in India in the early 1980s. The HIV situation in this country is really bad, especially among men having sex with men. For the simple reason we were totally neglected. Because we're invisible within the population. It was known here as a disease of female sex workers. But the very fact that MSM now is in the core group means it is accepted that MSM also are at high risk, and the stigmatization and discrimination is going to increase alongside that. We need to look after our sick. We need to be better able to sensitize the health delivery system to know that such men are everywhere, and stigma and discrimination has to go. If you can't get transgendered or male sex workers to, they're not allowed past the gates of hospitals, how do you give them care and support? How do you facilitate access to health delivery systems? I think the programs that are working among men having sex with men are those where community-based groups like ours have been empowered to take control of their programs. We never realized that HIV and STDs would be such a high priority area and so many men would die. But the sad part is it's going to be a genocide where a lot of us are not going to survive this epidemic.
There's still a lot of people that are still dying from HIV and AIDS. You find that a lot of people are still dying while they're still on the waiting list for medication. I'm a clergy. Our church is called Metropolitan Community Church. I've been positive for the past 7 years. Even within my own congregation, there are more and more people that are getting infected. And that's the problem that I'm faced with, because even when they know that they are positive, they felt that they couldn't talk about it and they couldn't be open to the community because of being scared that they will be stigmatized. Our government, even the messages that are being given are messages of heterosexual, of men and women, and we don't have messages that are there for gay and lesbian people. Even though we've got, the constitution that is liberal, that accepts everybody, but there's still a lot of, homophobia in terms of religion, in terms of the law itself.
La epidemia se va a volver mucho más fuerte. en Latinoamérica y el Caribe. Muchas personas no quieren asistir a los centros hospitalarios porque inmediatamente el diagnóstico de VIH positivo es igual a ser gay. En Latinoamérica, hombres que tienen sexo con otros hombres no necesariamente tienen que ser gays. El tabú, el esconder, el decir no lo digas, quédate callado, es que hace crecer las posibilidades que yo quiera VIH en cualquier momento. Yo vivo con VIH ahora porque no tuve con quién conversar. Yo no sabía si es que iba a tocarme a mí o comprar un condón o no comprar un condón. Creo que el cambio se está dando en cuestión de prevención. Creo que los gobiernos se están dando cuenta que es imposible decir abstinencia. Hay acceso a tratamiento, hay prevención, sí, hay programas que son buenos, las cosas han cambiado, pero la palabra que yo te diría ahora es sostenibilidad, prevención y tratamiento. Los gobernantes de todos los países dejar de manipular la salud de todas las personas. Pienso que cuando se trata de salud no existen convenios, no existen tratos, no existen monopolios. Salud es salud. No se puede negociar con la salud.
We did phenomenal work in the 80s and 90s at lowering the number of new infections. We've got to get back to that, but we have to find the will, the political will, not only here in the United States, but around the world.
I think there is a collective choice involved in letting people die and letting people suffer, rather than allocating the resources and the leadership necessary.
This is very much a social and political and economic disease. It is not just a medical disease.
Es muy grande, muy ambicioso, pero si no lo vemos así ahora, ¿cuándo?
There's an old saying that in Hinduism, every sinner has a future and every saint had a past. You know, so everybody and everywhere, every human being always has hope.
People don't need to die from HIV and AIDS. You know, it's a manageable disease, and it's something that people can live with for many years.
You never know what time it is in someone else's life, but for someone, now is the time that they're willing to do something, that they're willing to go out on a limb. For someone, right now is the time when they can do that.